We are treating Ed's failed knee replacement. After the replacement, he couldn't really bend his knee more than 90 degrees. So we just did some, did we do shockwave yet? Yeah, we did extracorporeal focused shockwave. It sends acoustic waves of energy to break up calcific adhesions. I saw, can you show me your post-surgical x-ray? There are some calcific, it's like tendonitis in the popliteal muscle, so that could be preventing some of the flexion. And we did some class 4 laser to help loosen the tissue.
The side view or the front view?
The side. And we did use these myofascial release tools to break up the adhesions around the knee. It could be post-surgical scar tissue like on the surface. So right now, after trying to break up, see those adhesions in the back, the white, opaque, and then now it could be the hardware is just not functioning correctly. I don't like how the kneecap is, there's not much space. That could be preventing flexion in the artificial hardware here. So let's see if we get past 90 degrees with the traction. That's not bad, look, past 90.
I can go more.
Yeah, go all the way. Okay, let me get this more. Okay, straighten your leg. Okay. Go ahead and push the device. Okay, all right. Hold on, let me unlock it here. Okay. There you go. Okay, go ahead and flex all the way. All the way. And then provide overpressure and straighten. Slide and flex all the way. And straighten and flex. I'll push it more. I even got some joint play, so we could clearly get past 9. You're at 45 degrees, but if from straight, all the way straight to pure flexion, go ahead. I mean, that's like 135 degrees, definitely.
Is it? You think so?
Oh yeah, because from
see it.
straight past 90, we're at about 125 about. It's 90 plus about 35 degrees or so. I mean, look at that angle. That angle is 45 degrees. So, okay, let's do it one more. And apply overpressure. No pain.
A little bit discomfort, but not really pain.
Straight. And back. Yeah. You definitely feel more flexion, right?
Yeah.
Yeah. Because before you were stuck at 90 like this, and now we got, we got like at least 35 degrees more flexion. That's great. So keep on doing that. Break up the adhesions, using the traction to get more glide, get more flexion, and go from there. Let's test it without the device, how much you could do it on your own.
Could you grab my glasses?
Yeah, passively.
Go ahead, 99-cent glasses.
Go ahead and flex your knee.
Yeah, I could get more if this thing wasn't here. Maybe if I put it over here.
Okay. Go ahead and straighten your knee and flex. Yeah, look at that. Definitely past 9. You want to get a side view? Yeah. That's better.
Yeah.
How many percent better, more mobility and flexion do you feel compared to day 1?
Probably 15, 20 degrees.
Yeah.
I mean, I can get a little bit more.
Yeah. So 20 degrees more, and this is what, your 4th treatment?
5th.
Yeah, and I said about 6, and
Yeah.
we can do maximum. So one more, get a more few degrees of ranges, and hopefully we'll get to your 125, 135.
That'd be awesome.
All right, thanks for watching. That's how we do it.
Sure.